Hi, my name is Dominique from Well Medical Arts, and I'm going to be teaching you about the difference between Xeomin and Botox today. One of the common questions the front desk and I get asked to answer. So here it is. Both Xeomin and Botox are botulinum toxin type A. They are just two slightly different brands. The Xeomin is Inco botulinum toxin type A, and the Botox is Ona botulinum toxin type A. Both of them are classes of medications called the neurotoxins because the way that they work is they intoxicate your nerve just temporarily, so the nerve can't make a proper conduction to the muscle, then the muscle can't make the contraction that causes a wrinkle. So it's a muscle relaxant. They are both locally acting muscle relaxants. They are not very different on a molecular structure. The Botox is the botulinum toxin type A with a couple of surface proteins, and the Xeomin is the pure botulinum toxin, no surface proteins. When the research was done, they compared the Xeomin to the Botox, and they looked at how quickly it kicked in, how effective it is, and then how long it lasts. And it ended up all within 1% of the Botox. So 1% is statistically insignificant. They're showing that it's really not very different. This is when the Botox company did it, the Xeomin company did it, and outside researchers. So they're both just two different brands of the same medication. It's very, very similar medication. So the real important part is, what can we do with them? All kinds of interesting things. Starting at the top and working my way down. The corrugator muscles, and that is for the 11s in the glabella. The horizontal lines through the forehead. We can do a couple of different kinds of brow lifts. One above the brow, one at the lateral brow. The crow's feet. The nasalis for the bunny lines. The procerus in the middle for the line that goes across the bridge of the nose, like the glasses line. You can actually do the tip of the nose to pull back this way, the base of the nose to lift up this way. If someone has a gummy smile and they want to drop that upper lip down, we can go right up here to drop it down to cover up the gums. Some people have this little horseshoe line when they smile. A little bit above the upper lip helps smooth that out. Any of these little fine lines around the mouth, just put one unit in each little line. This muscle, the angularis, we can put a few units at the corner of the mouth to make it turn up, and then a few units down into these pockets, and that helps lift up the pre-gel, helps soften that. The muscle that causes a lot of the jowling on the side of the face is the platysmal sheath. It goes superficially over and wants to pull down, so we go boop, 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 and that helps lift up. Some people have little pitting or dimpling in the chin. Put a little bit of Botox into that, it softens it out, and then we can do the neck. There's 3 different ways to do the neck. There is the central band, and we're putting it right underneath the chin. That helps lift up this way. The platysmal bands, which are very strong, watch this funny face, you go, grab up the bands, Botox the insertion point and down the bands, and that helps pull back this way. That's a great technique. And then some people have the rings. When we do a normal Botox treatment, it's in the muscle. When we go in to do the rings, it's intradermal, so just right under the surface of the skin, and it smooths out that little rings. We use that intradermal technique as well, right underneath the pupil for those tiny little lines under the eye, or when some people have what's called big eye, small eye, one of the smaller eyes to get the lid to open, we go right on top of the eye, and that helps open it up. So there's really not much that you can't do with the botulinum toxins. It's a muscle relaxant. When we use it cosmetically, we relax a depressor and it lifts. And if something is a depressor, we're going to be able to get it to lift as well as soften wrinkles. If you think you would benefit from any of those multitude of uses, come on in for a consultation. Each person's muscularity and strength is a little bit different, so we'll look at where you need it, how many units, calculate up how much it would be. Each person's a little bit different. It depends on the strength of their muscularity, and we will get that face softened and lifted for you.